I want to welcome Elijah Biggs, a managing consultant at IBM. He's also in the Knowledge Capture Chair for the ACT-IAC Health Community of Interest, and he's a graduate of the ACT-IAC Associates 2020 Leadership Development Program, which is how I met Elijah. So thank you so much for joining me today.
Hey, Jeremy, thanks for having me.
So for those who haven't had a chance to kind of interact with you like I have over the last year or so, explain a bit about your background, where you're from, who you are, and what you do.
Yeah, of course. So I am from Western Maryland. I grew up in a small, sleepy town, Cumberland, which is for DC locals and natives on the way to Deep Creek Lake or on the way to the Wisp, depending on what kinds of activities you enjoy. I grew up there and then went to the University of Maryland. And at Maryland, I studied bioengineering. And I didn't know that I wanted to go into IT services. But I stumbled through an internship with GE Healthcare. It was more of a sales internship. I came out of it and it was in Wisconsin. And I said, well, I don't really want to be in Wisconsin. I like the DC area. I like engineering. And I was working at Children's National at the time, the hospital, in a research department. And at Children's, we were doing some medical research on CT images. And I thought that that was really cool. You know, the bioengineering backdrop mixed with some scientific research. And IBM, who's my employer currently, was, broadcasting commercials. And I think it was for the Olympics in 2016 about all of the work that they were doing in medical and Watson medical, Watson AI level of work. And I thought that was really interesting. And I was in this program at the University of Maryland called Quest, that had funded grants for the IBM had funded grants for Quest, which was quality enhancement systems and teams across many universities, and we're recruiting talent out of the programs. So that's how I got lined up with IBM. And since I've joined, I've taken on a number of roles, mainly in the DHS and federal health communities. Started out with TSA, spent a year and a half there with their electronic baggage screening program. Learned a lot about software, hardware integration, learned a lot about information technology that I didn't see in the bioengineering curriculum that I was part of at Maryland. And I came out of that a smarter guy about federal contracting as well. After that, I spent time with FEMA and their National Flood Insurance Program, NFIP, managing a team that was working in an agile capacity on a product that was getting rebuilt, so modernized in a way. And it was actually for procurement planning and the work that FEMA does across all of the National Flood Insurance Program at the community, state, tribal levels. So it was more of a Scrum Master role, and I now sit within IBM Federal Services Agile Center of Excellence, and I am working with FDA to stand up some processes and methods as they manage tobacco product regulation and review processes.
Wow, that's an interesting journey. And I mean, you're still early in your career and already had kind of some varied experience, it sounds like.
Absolutely.
So how did you decide? I mean, so you said your background's in bioengineering in school. Was it just the internship opportunities that drove you into the IT field, or was it a distinct decision to, instead of going down that maybe research and development route, to go into an IT career?
Yeah, it was more so a draw to the Washington area, and knowing that federal contracts and IT federal contracts are a big employer in the DC metropolitan area. So I didn't know much about what existed inside of IBM. I knew that Watson Health was really cool. And I knew that being part of a large organization, there was an easier opportunity to move from one industry and one service area to another than having to leave the company in order to do that. So I knew if I was going to be in a big company like IBM, I could move from services to research, and I could move from federal to healthcare. But you're young and you think you know what you want, and you learn something whenever you get into the door of an organization. And so I didn't really know what I was getting myself into. I knew about bioengineering. I didn't know so much about IT. I didn't know so much about federal services, but I said, I want to be in DC, so why not? And that's when I accepted that offer and got lined up with TSA to do some really interesting stuff with their electronic baggage screening program. And it related really well to the work that I had done at Children's, based off of the fact that most of the screening equipment that TSA manages is effectively X-ray machines and CT machines. They've just tuned the systems to do different work. So rather than scanning your brain or scanning your arm, they're scanning baggage. So applied some of those concepts that I had learned through school to the challenges of the electronic baggage screening program, and was able to learn both about hardware as far as the baggage screeners, but also about the hardware software integration, a big part of information technology, and the user experience. So how does a screener, how does a transportation security officer, someone that stands in front of that screen for hours and hours and hours, need to have the system work for them, need the configurability of the system, and need updates that make sense versus updates that are burdensome. So there's also my first kind of look at the design methods that were really focused on user-centered design.
Interesting. Was that a hard transition in terms of educationally? Did you have to like read a ton of stuff to make that transition?
TSA was good to me. So I spent most of my time on client side, and a lot of folks there were really eager to help bring me up to speed. Both other contract teams that I was working with, IBM was a subcontractor on that program at the time. So I was working with many teaming partners, all eager to bring me up to speed. I had some insight into machine learning from my work at Children's. So I was eager to disseminate that. And as a return, was getting a lot of information about all sorts of nuances within baggage screening, from hardware integration to software user experience, requirements gathering, government contracting, the whole gambit.
Interesting. So, I mean, and then how does that transition to where you're doing the agile practice now? Did you learn a lot of those skills in that early time frame, or was it, something you just kind of picked up along the way through multiple projects?
Yeah, so we were talking about TSA Fast. So I was working on TSA, and that program actually finished up. The one I was working on, electronic baggage screening program. So the way that the IBM services organization works is, okay, well, that project's ending. Let's try to find you another project, much like other, federal contract agencies. So I stepped back into the TSA, IBM at TSA account. And one of the opportunities where they needed extra hands was working the fast response. So IBM responded to TSA's flexible, agile, scalable teams procurement opportunity, and they needed extra hands to make sure that proposal was sufficient and approved by TSA to be one of the vendors on that contract. So that's where I learned a lot about agile, is prepping for the solicitation and then helping respond to the solicitation. And I worked really closely with the individual who leads the Agile Center of Excellence at IBM, Chris Perdue, during that time. And based off of the experiences that I had, what I gained through that response time frame, I joined that team. And that's whenever I got sent out to FEMA to work a transformation there, where they were maintaining some applications that I would say were in their legacy state. So O&M, sustainment, large applications, slightly brittle, and determining where to modernize those, and using an iterative incremental approach to do that modernization. And that's where I had a lot of hands-on experience doing the things that I learned during the solicitation response, by way of documentation and classroom setting or training setting.
Oh, interesting. So as you've kind of made this journey through a variety of experiences, what's something you've seen that if somebody came to you, Elijah, and said, you get to make a decision today, here, what is something that we do poorly, or what's something that you would change or improve if you could, that you've witnessed through your career so far?
Yeah. So the federal workforce is huge, but it's relatively discrete. So pockets of individuals and organizations as a whole sit and operate, I don't want to say in silos, but close to silos.
Yeah.
And that's really where ACT-IAC comes into play. So you and I met each other through ACT-IAC. Yes, associate's program and the other professional development programs is one collaboration space. But I see the communities of interest, and for me, really intimately, the health community of interest as a place to collaborate at an interagency level and at a industry plus government level. That is one of the deficiencies that I'd seen in my time with TSA, is really having the ability to work with other agencies that had the same types of organizational needs, the same challenges that TSA was going through. For example, CBP also has screening equipment. They have screening equipment of cargo. They have screening equipment of baggage of cars. It's just at a different location. And then if you think about internationally as well, TSA has some visibility into international airports within their global systems division or office. But the name doesn't matter so much. Even at an international level, there are plenty of opportunities for collaboration. For example, at FDA, today I see some of the limitations of collaboration between FDA and others in the federal health space for the ability to manage regulatory review processes, everything from submission of data to federal agency, all the way through monitoring of in-field use of those products and how that data can end up maturing the review pathways. And we can see that with COVID, for example, and the adverse events that stem from COVID. Was that under CDC's wheelhouse? Is that under FDA's wheelhouse? How do those agencies go about collaboration in a way that closes the loop so that changes can be made to processes in a way that makes sense, in a way that improves outcomes?
Yeah, that's definitely, as a federal worker, I would agree with you. That's definitely a challenge, is cross-agency collaboration for any number of topics, and how do we interact, but both from sharing information, having meetings, and even just the content we're collaborating on. That's just a number of challenges, because different agencies have different security postures with different tool sets, and you're right, it's a pretty big deal.
And oftentimes it comes down to the fact that services organizations, contract teams, exist on both sides, so that they can help bring best practice lesson learned from agency one to agency two. Another place that I see it is within organizations like USDS and the US Digital Service and 18F, working across government as almost government employees providing services to government agencies to pull out the lessons learned, best practices, and string them together in a way that, to that same point, improves outcomes and reduces risk at the end of the day by the fact that, we've seen this type of business challenge. We know this type of need, and they're also doing it next door.
Right. That's fantastic. So where do you see yourself? What do you see for your career? Where are you headed?
Yeah, I mean, that's a good question. That as an agile coach, I do some levels of predictive planning with teams and adaptive planning with teams. So if you asked me this question years ago, I would say something differently that I'd say now, and I'm sure years from now I'll say something differently as well. Because part of the plan happens and part of the plan doesn't happen, and you come out with a new perspective and new desires based off of where you are at each point in your trajectory. I definitely still want to be working within ACT-IACT and working with the ACT-IACT community, the health community of interest. 5 years from now, I might have gone through Voyagers, dare I say, but as a professional development opportunity. But a few of the pet things that I'm interested in right now that I hope to use in the future, I'm working on an AWS certification. I think that's a really neat place to learn and to grow based off of the fact that they've got a big presence within the federal services community. So that's the solutions architect one. I'd done the cloud practitioner, certified cloud practitioner last year. So excited to explore that further. Within the federal health community, there's a big presence and pressure on FHIR, FHIR, which is a data standard for medical information. Based on my experience with children's, I saw some of the limitations there. We were working in a Cerner environment. We couldn't pull data from other EMR systems well. And even working loosely with VA as in the federal health community, I can see some of the limitations there. I mean, they've got a big, I believe, Cerner enterprise goal, but data is going, and you know this, and everyone listening knows this. Data is going to be the differentiator in businesses of the future and organizations of the future for decision-making purposes, but also from information radiating perspective, and then where you put your eggs, what basket you put your eggs into. So I'm interested in FHIR because it's a standard that was set by CMS in 2019 or 2020. And there is going to be a large level of conformance to FHIR specifications for medical information in order to help start to pull the pieces of across the value stream. So not so much, okay, well, patient A is coming into VA hospital or VA center to attain this service, but it's all around that citizen service. So you might as well have systems that talk to one another so you can deliver better outcomes, have better predictive intel in medicine, and then provide better treatment to folks who have a need based off of the data points that have been left through time. So that's not where I want to be in 5 years per se, but those are some of the skills that I'd be interested in exploring more and hope to put to use in that 5-year trajectory.
That's an interesting trajectory, right? And what's important, right? And people tell you this, and your parents probably tell you this, right? It's just having that kind of vision of where am I headed? And you're right, it's iterative. As you go, you can redecide, right? Oh, okay, I've learned a lot here, and based on what I've learned now, I can head here or whatever.
Absolutely. Yep, it is iterative, and based off of each decision that you make, you learn something new.
Right. And
whatever you learn new, it helps you adjust towards where you want to go from that point. So I keep some of it up there. I guess it's partially a non-answer, but some of the skills I hope to leverage and use here in the years to come.
Well, Elijah, I want to thank you for coming on the podcast today. It's really great to hear more about you. I mean, even when we interact in the program, this is probably the longest we've talked together, just the two of us. And I'm looking forward to continuing my interactions with you in ACTIA. So thank you again.
Hey, thanks for having me, Jeremy. And whenever that 5-year mark hits, you'll have to have me back on so I can tell you what actually happened.
We'll do a part 2.
There we go. Sounds great.